Hello students, welcome to Vedantu NEET English. I am Ms. Gopika, your own biology master teacher. I hope I am audible, visible and the presentation right behind me is visible. Please let me know in the chats, are we live yet? Yes, quickly. Yes, I think we'll be live, right? Very nice. Yes, we are live, right? Awesome. Okay, so students, last class we did reproductive health part 1. Today we are going to do reproductive health part 2. Now, how many questions can you expect from this chapter? You can expect around 2 questions from this chapter. That is 2 to 3 questions is the general. You can just look at the entire flow chart from 2019 to 2024. Minimum of 1 question, maximum of 3 questions is expected out of this chapter, and this chapter is very important because more than just scoring marks, this chapter gives you an understanding that many times you don't get it from your parents or from your relatives or cousins or whatever, right? Sex education, which is a very important topic right now because we all know what is happening recently in India. It is very important that as a teenager, as an adult, some of you might be adults, some of you might be teenagers, you should be aware of what is the situation and how you need to deal with it, what is the right solution for it, especially because you are going to be the future doctors and everything that you do is going to impact in a different way to the society, right? So that way, this chapter is very important. I feel more than just marks, I want to do this chapter to make a lot of students educated about things that they are not aware of. Okay, so last class also we had a very open heart conversations about these things. So let's do a quick recap of what we did last class. Are you all ready for it? Yes, we are going to do a quick recap of what we did last class. So this way what happens is, you know that okay ma'am, this is what we did and this is the just like a revision. Okay, just like a revision. Ready? So last class students, mainly we went through all the barriers, right? When we are doing sexual intercourse or coitus with coitus, generally we have to take care of some things to avoid unnecessary or unwanted pregnancy. To avoid unwanted pregnancy, what are the things that we can do, right? So students, basically there were few techniques that we have to go through. So let's write it this way. Okay, I want all of you to write as well. Six techniques. Okay, all of you start from the first one. Which is the first one? Yes, I cannot see any of your response. Little more Josh can be there, and many of you haven't marked the attendance as well. Quickly mark the attendance. Every class I should tell this. Otherwise you people won't do. Do I come to the class after you tell me? No, right? I come to the class because I want to teach all of you. So same way you should mark your attendance without me telling every day. First is natural or traditional method, which totally happens on a calendar rhythm. Like it's a rhythm that you check that okay, now periods has just got over. During the ovulation time we will not be doing any sexual intercourse. So that kind of a rhythm that is depending on the calendar. Okay, depending on the calendar. Yes, what happened, Sony? Hi. Okay, look here. So natural or traditional method. Under natural and traditional method you have basically 3 techniques. Which are the 3 techniques, students? First one is the withdrawal method, right? Withdrawal method. Second one is periodic abstinences. Periodic abstinences. I'm not going to explain any of this because last class I've done an explanation on all of this. This is just a recap, so all of you remember the connection. Okay, third one was lactational amenorrhea. Okay, amenorrhea. This was the 3 natural or traditional method that people have used, okay, to get rid of unwanted pregnancies. Okay, but these are all very like try your luck. Okay, now you take a lucky draw and you expect that okay, it will happen for me for sure. It is like that. It's kind of like a probability test. Okay, now next one. After natural or traditional method, the most common method was your barrier method, right? Barrier technique. In this barrier method, students, the very common thing that we all know is condoms. Okay, condoms were used. And which is the most commonly used condom? Can you tell me in the chats? Condoms were used, cervical caps were used. Okay, wallets, diaphragms, to enhance this barrier method. Right, very good. To enhance this barrier method, there was also use of spermicidal creams. Yes or no? Use of spermicidal creams. To enhance this, we had spermicidal creams, we had jellies. Yes. It's okay, Chitra, you know the spelling. No, it's okay. Yes. And foams were used. So this was the barrier method. Yes or no? These were the barrier methods. Okay. From barrier methods, we come into the which method, student? You can think of oral contraceptives, but if you want to go in order, you will think about IUDs, right? Intrauterine devices. So intrauterine devices also were categorized into 3 categories mainly. The 3 categories was the one which was non-meditated, that was your Lippes loop. Okay, then you had copper releasing ones. Okay, copper releasing one. Which was the copper releasing one? 3 examples were there. Multi-load 375, CUT and CU7. Am I right? Yes, non-medicated. Yes, very good. Okay, non-medicated, we had Lippes loop. Then we had copper releasing, multi-load 375, copper T and copper 7. This question has come multiple times as a PYQ. Okay, PYQ. Yes. Yes, got it? Yes, non-mediated. What have I written? Okay, done? Yes, copper releasing. Okay, students, just check the spelling. Okay, check the spelling. Sometimes when we write fast, we will make some spelling errors. You can just check that. Done? Yes. Next one. Next one, after IUDs, we spoke about oral contraceptives. Okay, oral contraceptives, implants and injectables. Last one was surgical method or sterilization method. You can use any of the word. Okay, surgical method and sterilization method. Yes. Yes. Okay, next one. Oral contraceptives, you have oral contraceptives, implants and injectable, students. Same combination you can use. That is, you can use oh wait. Students, one more is here, no? Here, one more is there. What is this? One more. Hormone releasing, right? Hormone releasing IUDs. This also has come as PYQ. Hormone releasing IUDs. Which was that? Progesterate and LNG20. Okay, these were the examples here. I have written it here. Okay, chalo. Now, oral contraceptives, implants and injectables can be having the same combination. That is, neither you can use progesterone alone or you can use progesterone plus estrogen combination. Okay, so this two combination, a pill was formed. So both of them, be it oral contraceptive, be it implants or injectables, same hormones were used. Okay, neither progesterone or progesterone plus estrogen. Yes or no? Yes. Tanuja, check if the attendance has been marked. Yes. My voice is breaking. Now is it fine? Wait, let me check. Examples here, I've written it here. Okay? I think it's just fine. Now just check. I think when I turn, the voice will come in. Turn, the voice is coming. Okay, give me 1 second, students. Here full thing is tangled. But if I untangle this also, it's going to be task. Yeah, but is it fine? Just let me know. Okay. I think I'll just drop the mic down because when I turn, the voice will go. Yes. Now fine? Okay, thank you. Thank you, Chitra. Yeah. Okay, students, oral contraceptive implants and injectables, as I told you, I'm going to write it here. It could be P or it could be P plus E. Okay, P plus E combination. These are the two combinations that will be there. Okay, yes. Now, surgical methods, two methods are there. Your vasectomy and tubectomy. Okay, one in males, one in females. Vasectomy, tubectomy. Okay, one is cutting off your vas deferens, one is cutting off your fallopian tubes. So this is not a very reversible method, it's a irreversible method. Okay, that is the reversibility chances are very less. Reversibility chances are very less. So this is what we did last class, students. This is the entire recap of what we did last class. Usually no one will do this, usually everyone will continue with the next class, but I wanted to make sure that you people remember what you did. Okay, now let's continue. See, it needs to be emphasized that the selection of a suitable contraceptive method and its use should always be undertaken in consultation with a qualified medical professional. That is, if you want, like if your conditions are different, like you're telling that after the first birth of the child, I want a gap of 2 years. So which contraceptive should I go for? So during that time, you have to consult a doctor and you have to ask the doctor ki, what can I do? Should I use barrier method or should I go for IUDs, or do you think pills are better? Maybe some doctors will suggest implants or injectables. So that kind of consultation is what they're talking about. Okay. Yes. Okay. So look here, one must, okay. So one must also remember that contraceptives are not regular requirement for the maintenance of the reproductive health. In fact, they are practiced against a natural reproductive event, that is conception of pregnancy. So they are trying to say that every time you use a contraceptive method, that does not mean that your reproductive health is going to improve, right? They are just trying to say that, okay, reproductive health, if you have to maintain, it is good, like to avoid STDs and all, you can use barrier method, that is you can use condoms, but it's not necessary all of the time. Now, if someone is trying to conceive or have a baby, definitely they're not going to use any of the contraceptive methods, right? That is because they want to conceive the baby. It is mainly to avoid unwanted pregnancy. Students, now voice is fine, huh? I'm holding the mic in the hand and teaching, so let me know if the voice is fine. Okay, now one is forced to use, I feel Nazar has come on the board or the mic every day. One or the other problems are there. Last time it was the mic, today, I mean last time it was the board, today is the mic. Okay, I need to call an astrologer and get it fixed now. So one is forced to use these methods neither to prevent pregnancy or to delay or space pregnancy due to personal reasons. Okay, no doubt the widespread use of these methods have a significant role in checking uncontrolled growth of population. That is also very important, yes or no? Because if in rural areas, right, if in rural areas this kind of techniques are not used, what happened? Students, I have a very personal experience here. So I was just standing randomly outside, and there was this, I don't know how many of you have seen the people who sell balloons, you know, different types of balloons on the, like for festivals and all that, right? That lady had around 7 kids. 7 kids. See, now I don't have any personal issues with that lady. I don't even know her. But my problem was those 7 kids also were in a very bad condition. Okay, 3 kids were malnourished, and the other 2 girls were doing helping the mother with the balloon thing, and the smallest one was just walking around, eating mud, you know, touching everywhere, asking sometimes if someone is coming out carrying a soda can or something like that, the kid used to go and ask. So the kid has already understood that if I want to live, I need to beg, or I need to, like, ask someone for help. So I felt very bad. I'm like, see, first of all, she's not able to survive with the balloon selling, because nowadays who buys it? Like, it's very rare. Earlier times we all used to play a lot with balloons, but nowadays they don't do. So in these kind of areas and these kind of rural places is where we need to sell contraceptive techniques, and that's when Saheli came, right? All of you remember, no? Saheli, which was found. That kind of contraceptive where you get an entire strip for 20 rupees, 24 rupees, they'll be able to afford. But the problem is, people have a very wrong myth in their head that, oh my god, if I use contraceptive, what will other people tell? What if I use contraceptive and I lose the ability to give birth? This kind of myths are present in olden days as well as now also in some of the rural areas, and that's why men hesitate to use some kind of barrier methods. Imagine 7 kids on the road with the mother. Like, we also feel to financially help, but they are very rude and arrogant because of the culture they have grown up with, because every week they are migrating from one place to another place. Okay, understood? So that's the reason this kind of this knowledge even you should have, because all of you know that sometimes I don't know, now also it's there, rural bond is there for all the doctors, right? That is, you have to go and serve at least 1 year in a rural area where you have to supply medicine, you have to take care of them, and that time you will meet a lot of people like this who have very narrow thoughts that, no ma'am, I cannot use this, I cannot take pills, my husband family will scold, my wife family will scold. That time you should be in a position to help them and tell them that, if you cannot financially grow a child, then you shouldn't give birth to the child, right? So that's a very painful situation, no? So yeah, widespread use of methods, a significant role in checking uncontrolled growth of population. And however, there are possible ill effects like nausea, abdominal pain, breakthrough bleeding, irregular menstrual bleeding, or even breast cancer, though not very significant, should not be totally ignored. Yes or no, students? So is this clear to all of you? That is, there are side effects. It's not like there's no side effects at all. See, everything that we take, side effects is always going to be there. Side effects are there, but the side effects are not very, very common. Like, it's not 100% that you'll get a side effect. You might get a side effect if you're taking a pill, right? A sexual intercourse has happened, and within 72 hours, you take a pill to avoid, or after or let's say the person got to know that they got pregnant, or they missed their periods. After that, they take a pill. That time what happens? Bleeding will happen, extreme bleeding will happen. That time the person might go through an extreme pain, and sometimes in some cases we have also seen where the cells, you all know, blastula, gastrula, morula, so those cells would have not completely been removed by the pill. So during this situation also, it's very, very important that we consult a doctor and then go for a pill, because after that you will be able to scan and see if there is any chunk of cells present. This has happened to many girls actually, people who just go to medical store and get a pill. Actually nowadays they don't give it in medical store, they have actually, government has stopped it, but some connection through they get it, and when they take that, what happens, there are chances that they extremely put on weight or they extremely lose weight. Like this, ups and downs are always there, so you should always be aware. Got it? Yes, exactly. Okay, now let's continue. Now students, look here. Intentional or voluntary termination of pregnancy before full term is called as medical termination of pregnancy. Students, I've put many MCQs today because many of you were requesting me, ma'am, please put MCQs or please do rapid fire. So I have done it today, okay? So students, look here. Imagine like a rape has happened. Due to the rape, the child has got pregnant. During that cases, what do? We do a medical termination, that is MTP, medical termination of pregnancy. Or second scenario, where the couples have got pregnant, but in the 3rd month or in the 2nd month or in the 1st month, they notice that the baby is not, like some deformities have happened, or a genetic disorder is there which cannot be rectified. In such cases also, the doctor itself will ask the couple to do an MTP, that is medical termination of pregnancy. Okay, got it all of you? Yes. So look here, or induced abortion. Okay, now nearly 45 to 50 million MTPs are performed in a year all over the world. Just look at the number, students. 45 to 50 million MTPs is happening in a year all over the world. See, which accounts to 1/5 of the total number of conceived pregnancy in a year. That means if imagine 5,000 pregnancies have happened that year, 1,000 pregnancies will be aborted. Okay, 1,000 pregnancies will go for an MTP. Can you imagine the ratio, like how your blood and when we made that this one, no, cardiac cycle, we told, no, 1/5 of the blood. Same way, see, 1/5 of the total number of pregnancies go for abortion. Okay, now obviously MTP has a significant role in decreasing the population, no doubt in that, though it is not meant for that purpose. Many people have this feeling, no, oh, I got an unwanted pregnancy, let me just abort. But it is not actually required, like in the sense, sometimes it is not a genuine thing to do that, okay, but many people do it. Whether it accepts or legalizes MTPs or not, it is being debated upon in many countries due to emotional, ethical, religious and social issues involved in it. I am sure all of you would have got to know that many, like few years back also, about MTP, there were many cases going on. Many high courts have given their own rules. Okay, many high courts have given their own rules that MTP is legal, MTP is not legal. Like killing, like doing a homicide, that is aborting the baby, is not according to our caste, so we will not make MTP legal. So many things like this have happened. Many marches have happened. Many rallies have happened on this basis. I don't know how many of you know, it has happened like 2-3 years back also, it was there. Okay, so this is a total, like, I have my own perspective, you have your own perspective, the government has their own perspective, so it will keep continuing. Got it? Not only uterus week, the entire body week. Students, why haven't you people marked the attendance? May I know the reason for it? Why haven't you people marked the attendance? Okay, now students, so whether to accept or legalize, it is totally mixed issues. Okay, now Government of India legalized MTP, very important, MCQ can come. Government of India legalized MTP in 1971. Okay, 1971, with some strict conditions to avoid its misuse. Such restrictions are all the more important to check indiscriminate and illegal female homicide, which are reported high in India. I am sure all of you knew during the entire, students, now only people have gotten so open-minded. Before, female homicide, right? Female homicide was very common. Okay, female feticide is very common. That is, if they get to know that it is a girl child, they have dumped the child. Now also it happens in some places where they dump the child in the garbage, they throw the child in the beach. Okay, like that many cases have happened because people have a very wrong notion that females become a burden later, like she has to get married, I have to give her money, okay, and I have to send her somewhere and she's not going to benefit me, because by the time we finish studying, they'll already start checking for a marriage, and then whatever she earns will go for the husband, and why should I take this responsibility? But in case it's a son, he will be earning, he'll bring a wife also, her family's money also we want. This is the concept, and I am openly telling you this is the concept now also in many families. Agree or not? I don't know how many of you agree to it. If you have ever heard your grandparents, maybe your great grandparents or your parents telling, or your mothers telling about how difficult it was for them to come out of that nutshell, no? It is actually true. And MTPs were maximum used for female feticide. Are you all understanding this? Yes or no? So, female feticide was like the main problem why MTP are not legalized in many countries. Okay, but yes, tell me, agreed? Yes, many people have heard it. I'm sure if you are a girl, at least once you would have heard such things from your parents or grandparents, someone, they would have told. Okay, it was legalized in India. Okay, legalized in India in 1971. Okay, but with the one strict condition that it is not used for your personal needs, like you feel like, oh, I cannot have a female child, so I will go and abort it. No, that was not allowed. Okay, yes. So students, as doctors, when you become future doctors also, such scenarios will come in your life where the couples come and tell, ma'am, please try to abort this, we do not want a female child, we were expecting a male child. That time you should have the sense to respond in such a way, be matured enough to make them understand. Okay, because because sometimes people are in such nutshell thoughts that they will try to convince you, they'll try to bribe you with money. It could be even with sons also. Many people tell that, no, I want a female child, I don't want a son. Like that, when scenarios come like this, you people have to take up a big role, and this is why this chapter is given to you. It is not because, oh, chumma, one chapter is given, so I'll sit and study. No, because such scenarios will come to you as well, where they convince you, they try to get a letter from you telling that the child has some deformities, please try to abort the child. So those situations, you have to be bold enough to make a decision and be very strong enough that whoever you are, I will not do something against my law. Right? I will not do something against my profession. You are taken, see, until the child, we know that this child is going to come out and suffer a lot. Yes, it's okay. But otherwise, if it is for their personal needs, that no, I want to focus on my career, I want to do that, I want to do this, I don't want this. During that situation, you should be bold enough to tell. Got it? Okay, so these things, you people will be the ones who will face it a lot. Okay, if you're going to this field, you will be the ones who will face it. So you should be in a position to answer well and be bold enough to tell a no. Okay, now why MTP? Obviously the answer is to get rid of unwanted pregnancies, neither due to casual unprotected intercourse or failure of contraceptive used during a coitus or a rape. Now MTPs are also essential in certain cases where the continuation of pregnancy could be harmful and even fatal, neither to the mother or the fetus or both. This is the main reason why MTPs are used, especially during rape situations, and especially when the pregnancy can cause harm both to the mother and the child. During this situation, MTP is completely legal. Okay, and it has also happened to many couples that they have used a barrier method, they have used a contraceptive method, but the method has failed. Okay, during that situation also it is legal. Okay, see, some situations you have to understand, okay, they are genuinely weren't prepared for it or whatever, like something like that, you understand and you do it. But some situations, some people do it for their selfishness. That time you should be in a position to tell a clear no. Okay, got it? Yes. Okay, so is this clear? Now MTPs are considered relatively safe during, very important students, questions will come from this. Thank you, Chitra. So students, boys again, huh? Yes, what is Divya talking? MTPs are considered relatively safe during the first trimester. Okay, that is up to 12 weeks of pregnancy. Got it? 12 weeks of pregnancy. That is almost 4 3s are. Okay, 4 3s are. That is around 3 months. 3 months it is safe before the 3 months. Okay. What is wrong with this voice? Yeah. Now clear. Give me 1 minute. Till then, all of you mark your attendance. Yes, fine. Is it better now? Better? Yes, clear? Something I did, I hope it works. Okay, I'll get it fixed before the next class. Okay, so second trimester abortions are much more riskier. So 12 weeks, okay, this is very important, questions have been come. So first trimester is safe, okay. First trimester is safe, that is up to 12 weeks. 1 month has 4 weeks, so up to 3 months everything is fine. You can do the MTP. But in the second trimester, when the woman goes to the second trimester, it is more riskier. Okay, second trimester is more riskier. Now, one disturbing trend observed is that majority of the MTPs are performed illegally by unqualified cocks, which are not only unsafe but could be dangerous or fatal. Okay, yes, is this clear? Yes, 12 to 16 weeks. Drink water, students. So what are they telling? Most of the majority of the MTPs have been done by unqualified people. That means what, students? It could be a person in the medical store. He would have given a pill and he would have told that, okay, you consume the pill, everything will be fine. Okay. Or it would be people who have not done MBBS even. Maybe they have done some bachelor's in some medical concept, or they would have done a course in medical, and they will be like, don't worry, I will do the thing for you, you don't take tension, and they'll take the same amount as a hospital, okay, and they will do, and that sometimes it can get fatal because of one reason I told you, that when we are giving a pill, right, when we are giving a pill, there are chances that this is the cell stage, right, this is the cell stage. Now the pill has removed, let's say, so many cells. Some cells are still remaining in the body, but the woman thinks that, okay, I got periods, thank God, everything is fine, okay, everything is fine, and maybe some of the cells are still accumulated there. So that can be fatal later. Got it, all of you? Yes? Students, just unqualified people, okay? NCRT is very fancy, very Gen Z it is. Just remember, unqualified people, okay? Now, another dangerous trend is the misuse of amniocentesis. This we already saw in our last class. To determine the sex of the unborn child. Frequently, if the fetus is found to be female, it is followed by an MTP. How sad it is to even read this. Okay, this is totally against what is legal. Such practices should be avoided because these are dangerous both for the young mother and the fetus. Effective counseling on the need to, like, you have to make them understand. Okay, now, diseases or infections are transmitted through sexual intercourse. Sexual intercourse are collectively called as sexually transmitted diseases or STD or venereal diseases. So students, it's always remember that it's very sad to even think that one's amniocentesis is used to determine the sex of the baby. That is, usually amniocentesis, let me tell you, it is mainly done to understand if the child has any genetic disorder. And this was legal for the longest time in India, not now, back then it was very legal. But they noticed a trend where immediately when the amniocentesis results are out, sex determination was done, okay, with the help of amniocentesis, and it was automatically followed by an MTP. That is, if my child is female, I would like to go for a medical termination of my pregnancy. This was a flow. So what they did, they made a ban on amniocentesis, telling that now no one can check if the child has a genetic disorder or do sex determination. See, now also in some cases, if the doctor finds some error in the scan, the doctor itself will do an amniocentesis, but that is again with the doctor itself, right? It goes as a loop. So that was the thing. So for that kind of couples, effective therapy has to be done or effective counseling has to be done. Got it? Chalo. Now, here they are telling diseases or infections. See, this is the main need for a barrier method. That is, whenever a disease is there, it will be transmitted to another person. Got it? So that transmitted diseases are called as sexually transmitted disease, STD, or venereal disease, or reproductive tract infection. Okay, three names have been given. Reproductive tract infections, RTI. Now, gonorrhea, syphilis and genital herpes, all this, genital warts, trichomoniasis, hepatitis B, and of course the most discussed infection, that is your AIDS, all of this are sexually transmitted diseases, okay? All of this are sexually transmitted diseases that could be passed on because of sharing of the same syringe, having sexual intercourse with multiple partners. This all happens when you don't, this is the main need for barrier method actually, okay? So AIDS are some of the STDs. Among this, HIV infection is the most dangerous. Students, all of you know why HIV is most dangerous? Yes or no? I'm going to teach human health and diseases very soon. So in human health and diseases, thank you Madhumati and Tanuja. In human health and diseases, you will get to know why HIV. Because HIV has the ability to make our macrophages into factory of their production. Like, I want to make more HIV virus, I will use the macrophages in the host body. And not only that, it will manipulate the central dogma where the DNA becomes RNA, RNA becomes protein. They will manipulate it to themselves. Like, oh, chill, I will do my job, right? So they will manipulate. When they manipulate, what happens is our body entire, the host body gets confused. At the same time, it also kills the T cells, which are our immune system. So it will reduce our immune system. So always remember, a person who is affected by AIDS does not actually die because of AIDS. The person dies because of even a smallest infection. Okay, got it? Because why? Immunity will be completely reduced. Okay, it will be, the immunity will be affected. Immunity will be completely reduced, because of which a normal disease also can affect a AIDS person. Is this clear, students? Okay, so here are some disease. They'll not ask you much about the disease, but just you have to know. Herpes are there, chlamydias, warts, trichomoniasis, hepatitis B, syphilis, gonorrhea. Okay, these are the diseases that are given. Now look here, some of these infections like your hepatitis B, okay, hepatitis B and HIV can also be transmitted by why? By sharing. Okay, by sharing of injection needles. Now students, what happens, it's not like you went and shared the needle. It could be because you went to do a tattoo, okay, and the place you went, okay, the place you went was not B, can also be transmitted. Voice is fine, no dear. Okay, yes, human papilloma virus. Now students, look here, it is not like you went and you were like, okay, please inject me with the same needle that the previous person injected. No, that's not how it happens. You went to a tattoo shop, and there are chances that the tattoo person is not very professional. He hasn't changed the needle. Okay, after you pin the tattoo, no, obviously you're coming in contact with the connectives, that is your tissues, right? So that time blood would have had mixing up. That needle was not changed. He used the same thing to do tattoo for you. Now what will happen, if that previous person had any of the STDs, there is high chance that you will also have it. Or second time, people use drugs. All of you know, no? So when they use drugs, they do injections as well. That time, same set of people share the injections, and if one of the person also has STDs, the entire group gets STDs. So sharing of injection needles, surgical instruments, this can also happen in hospitals where the hygiene is not maintained and the hospital people are very careless. They're like, oh, whatever happens, doesn't matter. So that's the reason why whenever you go for an injection, whenever you go to a hospital, always check if they have used a new needle. Okay, always check. Even when you go to a dentist, always check if they have changed the knob of that, because when they're cleaning the teeth, right, when they're doing something, we come in contact with the blood, because you know your gums are weak, right? Gums are weak, and when the gums are weak, obviously bleeding will happen, because at a high power the water will be used. Many people actually ignore this fact when you go to a dentist. They'll be like, teeth, no, what is a big deal? But always remember, this is the place where you always bleed, right? You brush also, sometimes when you brush and by mistake you turn here and there, there's a lot of chances that you have bleeding. Okay, so always check the hygiene. Do not go to hospitals which are very, like, you know, to save a 50 rupees, to save 100 rupees. Do not even go for a tattoo artist who will do an unprofessional job. Okay, always choose a good place where the reviews are good, everything is good, and also go to a clinic that is where people have, like, if the crowd is more also, students, be careful. Okay, they will, out of carelessness, they will do the same thing. Okay, yeah, what is the issue with the voice? Wait, 1 second. One second. Let me just check. Give me 1 minute, I'll just go outside. Hello. Students, am I audible? Yes, Harshine. Totally agree. My students have no patience. Students, this got disconnected. Can you see? I'll get current shock. There's a problem, huh?
Okay.
I think when this drops, there's a loose connection. I'm telling you, Nazar has happened.
मैं एक नया बदलवाने की कोशिश करता हूँ.
ठीक है, okay. Students, just adjust for this class. He'll fix it, okay? We just got to know that this issue has happened now. Every day in my class, one new issue will happen, so it's a blessing. Okay? Yes, chalo. Okay, so with an infected person, transfusion of blood, that is, imagine you have had a surgery. Okay, you had a surgery, or even at cases when even dengue comes, no, you know that a person has to give platelets, right? Okay, a person has to give platelets. If a person has to give platelets also, we have to make sure that the person whom we are collecting the platelets from, or if you are going to a bank, not the bank, okay, like a blood bank, and you're taking platelets, you have to check that person does not have any issue. Okay, so during a blood transfusion, okay, transfusion of blood, or from an infected mother to the fetus, we all know erythroblastosis fetalis also, it is not from infected mother, but you know that mixing up of blood will happen, right? Now, except for hepatitis B and herpes and HIV infection, other diseases are completely curable if detected early and treated properly. So keep this in your mind that these three diseases are not very easy to cure, okay? But other diseases are easily curable if we detect it at the early stage, okay? Yeah, someone has done black magic, correct, okay? Yeah, so the diseases are completely curable if detected early and treated properly. Early symptoms of most of these are minor and include itching, fluid discharge, slight pain, swelling. So these are the symptoms, students, okay? These are the symptoms of these diseases. That is, you might have a slight itching, fluid discharge, pain, all that, okay? Yeah. And in genital regions, infected females may often be asymptomatic and hence may remain undetected for a long time. That is, all of you know, when you study principles of inheritance also, you know, females become carriers, okay? They will not, okay? They'll not become, for longer time, they will not be known that, okay, this person has an infection. So most of the time, the female will be a carrier, okay? So females, absence or less significant symptoms in the early stage of infection and social stigma attached to STDs defer the infected for long time, okay, here, okay? Social stigma attached to STDs defer something and all, this NCERT writes sometimes, okay. This could lead to complications later which include pelvic inflammation. This is when the cases get a little more severe, okay. Pelvic inflammatory disease, okay, abortion, stillbirths, ectopic pregnancy. Students, ectopic pregnancy is when, normally where should pregnancy happen, okay, where should pregnancy happen? It should happen in the womb. Right, womb it should happen. But in some cases, the pregnancy happen in the stomach. Stomach mean proper gut I am talking about, okay? Proper gut I am talking about. So sometimes what happens, pregnancy happen in the stomach, and because of it, the woman will never get to know that they are pregnant because there will not be any much, swelling or like how you see, no, that will not happen. So ectopic pregnancies are very, very severe cases, okay? Very, very severe cases. Is this clear? Yes. Okay, chalo. Yes. Now, STDs are a major threat to a healthy society. Therefore, prevention or detection and cure of these diseases are given prime consideration under the reproductive health care programs. That is basically giving them the awareness, okay? Though all the persons are vulnerable to this infection, there is incidences are reported to be very high among person in the age group, okay, of 15 to 24. Are you people in this age group? Why in this age group such things happen? Because to be cool, for that excitement factor, you all you all have that, no, I want to be cool, ma'am, so I started smoking. I want to be cool, ma'am, with in front of my friends, so I started social media. I post about my life. Cool is just a word. Okay, cool is just a word. Yes. Yes, ectopic pregnancy is when the, implantation, when the embedding is happening other than the uterus, but most of this time it happens in your stomach region as well. I saw a lot of cases of ectopic pregnancy in the recent time where it has happened in the gut lining and other places where the embedding should have happened, it did not happen there. Okay, so ectopic pregnancy can happen in any other region other than the uterus. So in the womb where it should happen, it did not happen, it went and embedded somewhere else. Okay, so many cases you can see, you can just search ectopic pregnancy, you can see recent trends, you can see a lot of people, especially people from abroad, have gone through this ectopic pregnancy. Chances are more. Okay, so that is the reason. Now look here, students, in this 15 to 24 years is the period where a person, or according to our census, we have noticed high chances of having STDs, that is sexually transmitted diseases or reproductive tract infection. Okay, yes, ectopic pregnancy is harmful, but that also recent trend I have noticed, ectopic pregnancy, many people have also got healthy babies out of it, but majority times it's not, because students, imagine the entire procedure happens in such a way that uterus is facilitated, right? That is, nourishment will be given, so maybe on a long run the baby can be affected later. Okay, baby can be affected. Yes, it can be fatal, but there are cases where the child has come healthy as well, but again, that is rare chances. No, for everything there is rare, for everything there is exceptions. So like that, exceptions are there, but always remember the child might have an issue in the long run because of lack of nourishment, lack of vitamins and that liquid, everything. Okay, all that issues will come in the long run, but right now I have seen some cases where the child is fine. Yes, exactly. So at this age, for the fact that you want to be cool, right, what and all we do, we will regret later in our 20s. Okay, after you cross a 23, 24 years, you start regretting the choices that you made. No, haven't you all regretted looking at the album of your school album where you have like two big apple cheeks and you have your kajal till here, eyebrows till here, and lipstick, full red lipstick, and you'll be wearing a white gown and you'll be dancing for Shakalaka Boom or something, some song you'll be dancing. Okay, so haven't you regretted looking at your annual day photo? So imagine some mistakes that we do in our teenage will mark a big problem in our later stages, and that is the reason why our country feels so unsafe for many men, for many women, for both the genders, is because of some small things that parents don't correct the child when they see, right? Oh, he just stole 5 rupees, he just stole 10 rupees, he just hit her, or she just hit him. Like small things, no, later becomes a big crime by itself. So always remember that when you do small mistakes, it will lead to bigger ones. Always small steps that you keep will always lead to the bigger ones. Okay, no discount in that, it will happen. Okay, yeah. So that's, we regret our annual day photo, so obviously we are going to regret our life choices as well after some time. So look here, I couldn't think of some other song, I don't know why. I just thought about this song. I couldn't think of any other song. Okay, there is no reason to panic because prevention is possible. One could be free of these by simple principles. What do you have to do? Avoid sex with unknown partners or multiple partners because you will have high chance of having STDs. Okay, always use condoms during a coitus, that is to avoid again STDs. In case of doubt, one should go to a qualified doctor for early detection and get complete treatment if diagnosed with diseases. Usually students, when we know that okay, the first ever detection that you can have is you will have a lot of irritation in your reproductive area. At the same time, you will have fluid discharge. Okay, when your fluid discharge is irregular compared to the normal, if your fluid discharge is more, especially for the girls, you will understand that you have an sexually transmitted disease, or you have your reproductive tract infection. Okay, because UTI, you will have extreme abdominal pain, but if you have a fluid secretion that is abnormal, okay, which is not normal, that means you can be confirmed that you have an STD or an RTI. This way you can go and early diagnosis you can do. Okay, don't ask me how much regret I have in seeing some of my annual day photos. No, you people will, like, I cannot tell you how bad it is. Okay, so yeah, so students, we are all in the same page of life. Okay, now yes, okay, Tanuja, let's see if we'll make it. A discussion on reproductive health is incomplete without a mention of infertility. Yes or no? There are a lot of couples who are going through a situation where they are infertile. Again, see, some situations it is genetic, but some situations it is because of how we lived our 20s. That's how we'll be suffering in our mid-20s, right? If you are prone to a lot of alcoholism, cigarette smoking, then there are chances that you become infertile on a long run. Okay, so whatever you do in your 20s, early 20s, you will regret in your early 30s and as well as in your mid 20s. So look here, a large number of couples all over the world, including India, are infertile. Okay, infertile, that is, they're unable to produce child in spite of unprotected sex. That means even though they are checking that, okay, this is the ovulation time and this is the time we have to have sexual intercourse, still they are not able to be, they're not able to produce a child. Okay, nice. You're lucky then. Nim, you're lucky. The reason for this could be many physical, congenital diseases, drugs, immunological, or even physiological. It could be any of the problems why a person has got infertile. Now, to make sure that infertility does not become a, because students, please do understand that when a couple is not able to give birth to a child, it does not just make them physically weak, it affects their mental health on a big scale that you cannot even imagine. Like how you people would have felt, no, when you wanted to take a drop here, that same emotions or similar emotions these people will go through, because the entire society will see them as failures, because the society is very narrow-minded that if you have got married, you have to have a child within a span of 1 or 2 years, otherwise you are a failure. Right, you are not good to be parents, whatever that question marks come. So these things affect them mentally a lot. So to avoid that, to not make a toll on your mental health, we have assisted reproductive technology, or ART. Okay, or ART, that is your assisted reproductive technologies, which help a lot of couples to have birth, but in a different way. It could be test tube baby, it could be ZIFT, it could be GIFT, it could be multiple techniques, but the techniques are there, right? Yeah, relatives play a very important role in that. Okay, giving tension. Okay, now, so the female is blamed for the couple being childless, but this is same thing what I just told you, that it is actually a toll on the female, especially because everyone will question the female, telling that you are not capable of being a mother. So that becomes a question mark, and many people have even committed suicide, to attempt to commit suicide because of this. So this kind of technologies has helped, a lot of what did I helped a lot of couples generally. Okay, helped a lot of couples. Chalo, let's see which are the exact ART technologies. First one, in vitro fertilization, or your IVF. Okay, IVF fertilization outside the body. Okay, outside the body, in almost similar condition as that in the body, followed by embryo transfer. So first we have in vitro fertilization, which is happening outside the body, not inside the body, outside the body, in a lab condition. The same setup is done. Students, how we have tissue culture, all of you know, no? An explant will be taken, it will be grown, and the complete individual will be grown. We provide the nutrient medium. Same way we give a lab setup. No, same way in vitro fertilization means something that is happening outside. So it is happening outside the body, okay, outside the body in almost similar condition as that in the body, okay, followed by an embryo transfer. The embryo will be transferred to the female. Now is one of the methods. In this method, popularly known as test tube baby. All of you know test tube baby? Okay, test tube baby is one such method. In this method, popularly known as test tube baby program, ova from the wife, okay, what is going to happen? The ovum will be taken from the wife or the donor, and the sperm from the donor, obviously husband or the donor, okay, are collected and they are induced in the form of zygote under stimulated condition in the laboratory. Very simple, students. Husband, okay, wife, from this fellow sperm will be taken, okay, from her ova will be taken, it will be collected, fused to form the zygote. Okay, form the zygote. So look here, the zygote or the early embryo with up to 8 blastomere stage. Okay, yes, okay, look here, up to 8 blastomere stage, up to 8 blastomere stage. Students, I can call this the zygote or I can call it an early embryo, okay. So I took the sperm from the donor, I took the ova from the donor, we have we have fused it. After fertilization, we will form an early embryo stage or a zygote stage, and this can be up to 8 blastomere. That means it has to be below 8 blastomere stage, okay. Up to 8 blastomere stage could be then transferred into the fallopian tube, and this will be called as ZIFT, that is zygote intra-fallopian transfer. Okay, and the embryos with more than 8 blastomere stage into the uterus. So look here, students, if it is below 8 blastomere stage, it will be transferred into where? To the fallopian tube. In some women, what happens? The fallopian tube will be weak. Okay, 1 second, students. Okay, yeah. So students, what is going to happen here? If the fallopian tube is weak in the woman, okay, many people, it is there, students, the fallopian tube will be very narrow, or the fallopian tube will be sometimes twisted, sometimes it will be weak, it cannot take an early embryo. That time we can do a second thing that is called as your gamete transfer, okay, sorry, IUT, intrauterine transfer, where the embryo will be transferred into the uterus. That will happen only if the stage has gone from 8 blastomere stage, okay. So that I'll write it separately, but just look here. So an embryo with more than 8 blastomeres into the uterus, which is called as IUT, that is intrauterine transfer. To complete its further development, embryos formed by in vivo fertilization, that is fusion of gametes within the female, inside the body in vivo, okay, inside the body in vivo, outside the body in vitro. So if it is embryos are formed by in vivo fertilization, that is fusion of gametes within the female, also could be used for such transfer to assist those female who cannot conceive, okay, who cannot conceive. So in vivo and in vitro questions will come, so you should understand. You should understand, okay, in vivo inside, in vivo inside, in vitro outside, okay, vitro outside. So what did I tell? Are we done? No. To write this I have left the space. See, ma'am is so organized. Yes, what's happening? Okay. Students, 1 second, I'm dropping this here. I hope maybe some voice issues will come. Just give me 2 minutes. Okay, students, what did we learn so far? MTPs I'm going to write here, okay? MTP, that is medical. I want answers to come quickly in the chat box. Medical termination of pregnancy. Okay? Pregnancy. It is safe. Up to when it is safe? Safe up to 12 weeks or first trimester. Yes, clear? Voice will break because I'm turning and I'm holding this. Just wait for 2 minutes, okay? Now, it was first legal, okay? It was legal in India or legalized in India in 1971. Okay, 1971. This is about MTP. There's nothing much to write about MTP. Okay, nothing much to write about MTP. So we will directly go for infertility. Since when I write on the board, no, sometimes we cannot. Fertility. Okay, infertility is when the couples cannot conceive, right? When the couples cannot conceive. Okay, so that time we have one technology called as your ART technology, that is assisted reproductive technology. Okay, assisted reproductive technology. Now, how much have we learned about it? Yes. Yes, tell me. Assisted reproductive technology, we have some categories, right? So, first thing is in vitro. Okay, in vitro, that means outside the body. Okay, outside the body. So if I am doing in vitro fertilization, what is going to happen, students? Very simple thing. Donor, okay, male and female donor. Students, donor can be husband, wife, or if they notice that the sperm has an issue, or your what is that, ova has an issue, they will take it from outside. Okay, so that time donor and will form zygote or early embryo. Early embryo. Now for this transfer, you have two things to remember. If it is below 8 blastomere stage, if it is below 8 blastomere stage, you will do a zift. Okay, you will do a zift, that too into the fallopian tube. So zygote intra-fallopian transfer. Yes, yes. So it will be from the name itself, everything is there. Now you have to be ready to do the MCQs, okay, because MCQs is where you will go confused. Is it zift, is it gift, is it you know, full confusion will come. Okay, so zygote intra-fallopian transfer, this will go into the fallopian tube. Okay, transfer will be to the fallopian tube. Fallopian tube. Chalo. Now second one is if it is above or more than 8 blastomere stage. More than 8 blastomere stage. Okay, then where it will be going, students? It will go to IUT. Okay, that is intra-uterine transfer. Intra-uterine transfer. Okay, this is go to the uterus. Okay, very good. Okay, it will go to the uterus. This, if you understand, then PYQs of this chapter is baby. Okay, easy peasy lemon squeezy it is. Done? Yeah, now we have done only IUT, we will come to gift. Okay, we will come to gift. Done? Any doubts? Easy, no? Yeah. So medical termination we did, in vitro we did. Okay, in vitro is outside. In vivo also can be done, where the fertilization has happened in the female, but the female is not able to conceive. During that time also it will be there. Okay, no, nothing like that, NIM. Okay, yeah. Chalo, next we'll continue. Now, transfer of an ovum collected from a donor into the fallopian tube, that is gamete intrafallopian transfer of another female who cannot produce one but can provide suitable environment for fertilization and further development, is another method attempted. So what are they telling here? They're telling that imagine the ovum we have collected, transfer of an ovum collected from a donor into the fallopian tube, okay, of another female who cannot produce one but can provide suitable environment. So one can provide environment, one can provide the ovum. Okay. Now all of you know surrogacy, no students. The ovum will be taken from the donor, and the sperm will be taken, and another woman will be giving the environment, that is the uterus for the baby to grow. That is surrogacy. So that one, this is similar. So what is going to happen? Same thing. Transfer of an ovum will be collected from a donor. Okay, this donor from whom we collected the ovum cannot conceive. That means the uterus cannot conceive, like take care and nurture a baby for the 9 months. So that time what we will do, we took the ovum from this woman, okay, transfer of ovum, okay, collected from a donor into another female who cannot produce one, okay, they cannot produce an ovum but can provide a suitable environment for fertilization. This method also is attempted. Okay, is this clear? This will be called as gamete intrafallopian transfer. Okay, gamete intrafallopian transfer. Any doubts in this? Now, intracytoplasmic sperm injection is another specialized procedure to form an embryo in the laboratory in which the sperm will be directly injected into the cytoplasm. Okay, where the sperm will be directly injected into the ovum cytoplasm. Okay, that is intracytoplasmic sperm injection. This can happen if the sperm is not able to cross the layers, right? You have your zona pellucida. If this layers, the sperm is not able to transfer, then in the laboratory what we will do, we will take the sperm in the injection and we will do ICSI, that is directly into the cytoplasm of the ovum, we will transfer it. Okay. Now, infertility cases, neither due to the inability of the male partner to inseminate the female or due to the low sperm count in the ejaculates, could be corrected by artificial insemination technique. That is, if the male has a problem, right, that is the inability for insemination or the sperm count is very, very low. Okay, low sperm count, we can do artificial insemination. That is, in this technique, the semen will be collected neither from the husband or from a healthy donor. If in case the sperm that we are collecting is a healthy sperm, even though the count is less, but the healthy sperm, we expect that, okay, pakka results will happen. Okay, that fertilization will happen, then we collect it from the husband. But if we are feeling that no, the sperms that we got also, even though the count is less, the sperms we got also is unhealthy, like they're not healthy. Okay, then likes of what? Oh, it's okay, Madhumati, later it will happen. Okay. So students, what is going to happen? Okay, what is going to happen? Artificial insemination we can do, that is when the semen is collected from neither from the husband or a healthy donor, is artificially introduced into the vagina or the uterus. It will be called as intrauterine insemination of the female. Is this clear to all of you? Okay. That is when the sperm, we feel that, okay, the sperm cannot reach up to the vagina, we take the sperm, okay. Yes, we take the sperm and we inject it directly into the vagina. Okay. Oh, that also is happening, Tanuja. Very nice. It's okay. True students will come later. Chalo. Though options are many, all these techniques require extremely high precision handling by specialized professionals and expensive instrumentation. Therefore, these facilities are presently available only in few centers in the country. Students, even though we are learning it so easily, it is not this easy, right? It is not this easy because you should understand that these techniques are very, very expensive, and it is also a toll on both the couples mentally and physically, where the woman also has to take a lot of injections, the male also has to go through a lot of stress. During this situation, they might even feel of like just giving up. Okay, so this is not as easy as we talk. So obviously their benefits is affordable to only limited number of people. Okay, emotional, religious and social factors also, you know, affect these things and adoption of these methods. Since the ultimate aim for all these procedure is to have a children, in India we have so many orphaned and destitute children who would probably not survive till maturity unless taken care of. Our laws permit legal adoption, so they're telling adoption is another technique, but also remember, many people do not they have a thinking that it's not ours, right? If the child they are adopting is not ours, they have a feeling, no, families, everyone would be like, it's okay, keep trying, or go do IVF, do that, do this. But practically they will not be okay with adopting a child. That is always a barrier, it's always a boundary. All of you know that as well, right? So students, let's do GM Express. This is some yes, students, so after up to ZIFT we did, IUT we did, next one, tell me next one. Now again voice might break a little, but please adjust, okay, don't be impatient. Yeah, just tell me now, what did we go through up to IUT? Now imagine the one person is able to give us the ovum and that person is not able to give a suitable environment, okay? So we collect ovum, let's put female 1, okay, female 1 or donor 1. What is the problem in this female? This female cannot, okay, cannot provide suitable environment. Okay, so we collected ovum from them. Now this ovum will be transferred to female number 2 or donor 2 who cannot produce one, okay, who cannot produce one but can provide the environment, okay. So cannot produce one but provides suitable environment, okay, for growth. What is this technique called as? What is this technique? Quickly in the chat box. Quick. What is this technique? Technique is called as gift. No? This technique is called as gift. That is gamete intra-fallopian transfer. Yes, got it? Done? Okay, thank you, Dim. Yes, child will be majority, 90%, yes, Roshni, the child will be healthy. 10% here and there, sometimes problem can happen, but still child will be healthy for the major results that we see generally, okay. If you see the survey also, majority of the kids are very healthy itself. Now students, yes, now we have to talk about artificial insemination. First we have ICSI, okay, ICSI, that is intracytoplasmic sperm injection, okay, where the sperm will be directly injected. All of you wait for the PYQs, okay, into the ovum. Got it? ICSI. So sorry. ICSI done. Next what? Next is artificial insemination. Insemination when the male have a problem, right? That is, the male has a issue of insemination, that is inseminate, cannot form sperms, or low sperm count. Low sperm count. What are the two techniques that we can use? Chats are not moving. Not sure, Raj, what happened? Did any news come? Yes, tell me the answer. Quickly. Yes, unable to inseminate and low sperm count and have written. Tell me about what are the techniques? What are the techniques? Quick, quick. Look here. IUI, in this technique, what is happening? The semen will be collected and it will be introduced into the vagina, right? So, intrauterine. Did we write everything? Intracytoplasmic, yes. Intrauterine. So, here what is going to happen? We can do IUI, okay? Intrauterine insemination. Here what is going to happen, students? Very simple. Okay, here the sperm will be injected into the vagina or uterus of the female. Done? Yes, clear? Okay, intrauterine insemination where the sperm can be collected from a healthy donor or the husband itself. If the sperm is low count also but healthy, then the sperm will be injected into the vagina or the uterus of the female. Done? Yes, IUI. Okay, IUT and IUI, don't get confused. One is transfer, one is insemination, which will happen especially for the male when the sperm issue is there with the males. Okay, same thing goes here. Same thing goes here. This is also a type of injection, right? Okay, chalo, done. Okay, 2 pages I have written. Now we will do questions. First question ready? Chalo, let's do the first question. Before I go to the first question, I wanted to show you people all this. Okay, wait. Yes, this one. Okay, students, now you have DNA plus. So all of you can see it is right now at 4999. Okay, 4999, and this is what you get. You will get very important. You will get All India Test Series, complete NYT Test Series with bundle will be delivered at your doorstep within a week from the purchase date. You will get 50 plus popular ebooks, telegram groups, recording of the previous classes, 100 plus chapter test, unlimited access to free books. So with the that is the book, what is that, with the course batch, you will also get your All India Test Series. That is not All India Test Series, all the test series at your home itself, okay, at the home. So you can buy the course. Right now it's at this price. Okay, the prices might change. If the prices have changed, you will get the refund as well if you have paid like different money or something. So here you can see instant doubt solving, NYTs, hard copies of NEET long year test series. Okay, students, it's at 5,000. Make your decision, because I think for this price you will not be able to get any like so many things at one place. Okay, these are your teachers. You can see all your teachers here. Check. See, all the teachers are here. I am here. Okay, Shreyasa is there, Diksha ma'am is there, everyone is here. So make your decision wisely. Okay, chalo, first question. What does RCH stand for? Okay, what does RCH stand for? Yes. Quickly tell me. What does RCH stand for? Answers should come. I am waiting for your answers. If you're slow, then we'll all be slow. Oh, very nice. 3 is the answer. Okay, let's check. Perfect, very good. Reproductive and child health care. Okay, next question. Statutory ban on amniocentesis in India was necessary because it is a very expensive. It can tell about the chromosomal aberrations, that is a problem. It is an invasive procedure and carries high risk of abortion. It can be used for prenatal sex determination to be fetus, leading to female feticide. Okay, next question. Yes, why was amniocentesis banned in India? Is the question. Okay. Did all of them tell the answer? Yes, very good. Very good. That is, it can be used for prenatal sex determination of the fetus, leading to female feticide. Next one. Saheli is an what? Okay. Is it an NGO working for female child rights, midwife working in villages to help in child immunization, a national helpline number, or an oral contraceptives for females? Saheli, which was found by your CDRI, right, in Lucknow. What is it? Quick. Is it an NGO? Is it a midwife? Midwife is those people who take childbirth, okay? Okay. Oh, very good, very good. Very good. Oral contraceptives for females, which is having almost no side effects. Okay, that's why Saheli is so famous. Next one. The ideal contraceptive for females who want to delay pregnancy and or space children is going to be, according to you, which do you think a female should take if they want to delay the pregnancy or space between first and the second child? First child happened, after that maybe they want 2 years break. Which method would you use? Barrier contraceptive, period abstinences, IUDs, or hormonal pills? Okay, hormonal pills. Which one would you use? Quick. Three, okay. C3. Okay, all of you are telling IUDs. It's students, IUDs also can be used, but usually people prefer for pills. Okay, pills are used mostly, mainly because of the reason that pills have a warranty up to 2 years, like 2 years. Some are there even for 3 years, some are there even for 5 years. So that is the reason why people use hormonal pills. Okay, hormonal pills. IUDs also have been used by people. Many people use IUDs, many people go for hormonal pills. Majority, okay, majority goes for hormonal pills, because once some pills have been taken, no, it can go up to 2 years, 3 years. Okay, so that's why hormonal pills would be a better answer. Okay, got it? Wrong. It's okay, because it is a open opinion. Okay, some people do this one, some people do, what is that? Yeah, students, 2 opinions are there. Okay, 2 opinions are there, that is neither IUDs. IUDs is the most common, but many of them prefer hormonal pills. Got it? It is people to people, and majority wins. Okay, next one. Which of the following is incorrect regarding vasectomy? Okay, incorrect regarding vasectomy. It's a NEET 2016 question. NEET 2016 questions. Why Sony? What happened? Did I win some award? Chalo. In India, IUD is the most commonly used, okay? But to space or delay between two childs, hormonal pills are used mostly in India. Got it? So difference is there, Chitra. That is neither Chitra only, no? Yeah, neither it most commonly used technique is IUD. No doubt in that in India. But for spacing children, people usually prefer hormonal pills, okay? That's why the answer is like that. Okay, chalo. Tell me the answer for this. What have they told? Okay. Yes, very good. No sperm occurs in epididymis is one of the mistakes, right? Which of the following is incorrect? This is incorrect, right? Production will happen, just transfer will not happen. Okay, chalo, very good. Next one. In test tube baby procedure, fertilization is in vivo. So, in test tube baby, you have to tell, okay? What is the answer for this? Please take your time and read. It's a long question. Okay, it's a long question. Fertilization is in vitro, but embryo development is in vivo. Fertilization is in vivo, but embryo development is in vitro. Both fertilization embryo developments are in vitro. Both fertilization embryos are in vivo. Test tube procedure. Okay, in test tube procedure only you studied about ZIFT and about IUT. Above 8 blastomere stage, below 8 blastomere stage. Now the question is truly based on in vitro and in vivo. Yes. Okay, I think multiple answers are going to come out for this. Think and tell, take your time, no issue. Take your time, but think and tell. Okay, is it awesome, Gopika Ma'am? Amazing, Gopika Ma'am. Let's see. Okay, A 3. Oh my god, multiple answers. Decide one thing and tell. Students, according to this one, okay, your NEET PYQ, this question, one second. This question answer IUD is the most accepted, okay. So let's not go for hormonal pill. See, majority goes for hormonal pill as well, but according to your NEET questions, IUD was the answer key. So let's stick with IUD, okay. Let's stick with IUD, don't make the mistake. So I've corrected it here. Chalo, what is the answer here? Answer here. Option number 1, no, because fertilization will be in vitro, but embryo development will be in vivo, because if it is 8 blastomere stage, that is up to 8 blastomere stage, ZIFT will happen. If it is more than 8 blastomere stage, uterus transfer will happen, that is IUT will happen. The embryo development will happen inside the female, okay? Okay, inside the female, got it? Chalo, next one. The function of copper ions in copper releasing IUD. NEET 2017 question. The function of copper ions in copper releasing IUDs. Okay. I was just checking the key answer, because what happens is we think something, later key answer something else will come. Yes. Tell this is easy question. C for capto, okay. C3. Yes, very good. They suppress the sperm motility and fertilizing capacity of the sperm. Okay, chalo. How many weeks of pregnancies are considered safe for MTP? how many weeks of pregnancy is considered safe for MTP? Very easy question. Very good, very good. Good job. All the questions you people have done right. Okay, all the questions you people have done right. Very good. Yes. What's the answer? Okay, Madhumati is telling first. My name only doesn't come in ABCD, no students. I'll change my name. Yes, very good. It is obviously 12, right? 12 weeks. Okay, 12 weeks and first trimester. Okay, 12 weeks and first trimester. Okay, chalo, done. Okay, so do not forget about this deal. Okay, do not forget about this. Your DNA batch prime, make your choices wisely, because you will get all India test series, that is your entire NEET test series. Within 7 days you will get it in your doorstep. So if you're a student who wants to practice with OMR sheets and everything, then this is the course for you. It's right now at 5,000. So make your choices wisely, and we are done with the class. I hope all of you enjoyed the class as well. Yes or no? Did you all enjoy the class? So reproductive health chapter is done, students. So we have completed actually a lot of chapters. So I will just give you an idea which are the chapters we completed. So students also feel like they'll also be able to check, right? Check that, okay, ma'am has completed this many chapters. So let's start from 11th chapters. We will go first, okay? Thank you so much. Time went so quickly, exactly. Okay, students, let's start with which chapter? 11th chapter. Biological classification I have done. Okay, completed. 2 times I have completed both NCERT line and RNA series. Okay, biological classification is done, which is actually technically not a zoology chapter. Okay, biological classification done. Then structural organization, I am midway into that. Next chapter, next topic will be frog, and a revision of all your tissues. Okay, frog and cockroach will be done this week. Okay, this week. Cockroach this week. Then I also am writing now randomly molecular basis of inheritance done, except HGP. Okay, except HGP. Fine, except HGP it is done. Then I finished in human physiology. If you see, breathing and exchange is done, excretion is done, locomotion is done, locomotion and movement is done, neural control and coordination is done, body fluids and circulation is done. Okay, body fluids and circulation is done. Only chapter left is your chemical coordination. Okay, this is how much we have done. Here if you see, sexual reproduction in flowering plants is done. Okay, then microbes is done. Microbes chapter is done. Reproductive health is done now. Then students, which other chapter did I take? Microbes done. Human health and diseases is left. Okay, human evolution done. Evolution done. My god, I finished the portion now. Now I think only left is human health. Okay, human health, and this one also is left. Biotechnology is left. Their chemical coordination is left. After that I think portions will be done. Yes? No, evolution also is done. Evolution done. Okay, now I have only these 2 chapters here, and here chemical coordination. Chemical coordination is done. Human health will take a lot of time. I might do it in 3 parts. Okay, all the chapters are done. Biological classification, microbes. See, this many chapters. Who will finish in the month of August, students? And you people question us telling, ma'am, will you complete it? Biological classification 2 times done. Structural organization will be done by this week. Molecular basis done. Okay, breathing and exchange done. Excretion done. Locomotion done. Neural control and coordination done. Body fluids done. Okay, only chemical coordination. SRIF done. Microbes done. Human health done. Evolution done. Human health and diseases, sorry, reproductive health done. Human health and diseases, biotechnology is left. Okay, done. So almost all the chapters are done. Now we are left with some more chapters which I'll be doing in the month of September. Then my portions will be over. Then I'll start revision again. Okay, then I'll start revision again. So by then I want all of you to finish one class. Okay, finish one whole revision, then we will start our second revision. Okay, by September I'll finish all these chapters. So my zoology content will be done, so the zoology portions will be done. I have taken some botany portions as well. Sir has finished human reproduction, so that also is done. Biotechnology, both the chapters this time I'll only take. Last year one chapter Baswa sir used to take, one chapter I used to take, but this time both the chapters I'll only take. So that 2 chapters will be there. 4 more chapters, then done. Okay, September I'll finish it off, then we will do revision. Okay, September, October will be full revision, October, November, December again full revision, then from December question practice. Okay, are you all ready for this? If you're ready for this, then stay tuned, finish all these chapters by then and come back. Okay, so thank you so much students, see you all. If you haven't joined our Telegram channel, it is Vedantu NEET English Telegram channel. Okay, this is the Telegram channel link where you will get all the channel notes and everything. Okay, Vedantu NEET English, this is the Telegram channel, and if you want to join my Telegram channel, then it is Biology by Gopika. Okay, Biology by Gopika. These are the 2 Telegram channels you can join for all the links and notes. Okay, chalo. So see you all. Bye bye. Do not forget to like the video as well as share the video with your friends, and also let me know in the comments. I noticed that many of you did not comment in structural organization in animals, which I'm very upset about, because this is the first time I have done it as an NCERT line by line to help you more. Okay, and next class, well, tomorrow at 6 p.m. you have a class. Without fail, join tomorrow. Structural organization, I will be giving a quick recap of all the tissues, types of tissues, everything that you need to know about tissues, and for first 30 minutes I'll do a recap where you will be going through Gopika Ma'am Express, GM Express. After that I'll start with frog. Okay, next lecture is tomorrow at 6 p.m. Without fail, come for NCERT line by line and go and mark your attendance on that as well. So see you all tomorrow. Tata, bye bye.